Well, we know pediatric ICUs are in crisis with more sick children than the hospitals can handle. And many babies and young kids are fighting the respiratory illness that's known as RSV. Well, now drug makers say a vaccine for that is on the way, but how soon could it be available? For more this morning, we're joined by infectious disease expert, Dr. Isaac Bogosh. Good to have you with us.
Hey, good morning, Anne-Marie.
So before we get to the promise of this vaccine, we've been speaking with pediatric doctors all week about the crisis in their ERs. What are you hearing and following when it comes to RSV?
So RSV, it's a terrible virus. It's been around for millennia, and it's infected humans for the longest of times, and it really preys on the youngest and the oldest. So while you've spoken with pediatric physicians and heard about the pediatric issues, which are really nasty, we know that this also impacts the elderly as well, and it behaves very similar to influenza, which is also an extremely worrisome and dangerous virus that impacts the elderly as well. RSV behaves very similar to that. And we see lots of older individuals who get sick with this, who get a pneumonia, who end up in hospital requiring oxygen. So the very young and the very old are all significantly impacted by this. And we're seeing this right now in Canada across the board.
Is it similar to, you mentioned ventilators. So is it similar to COVID? Is it a long stay? Is it a shorter stay? Like, what's creating the crunch?
Well, in all fairness, I mean, we just have a significant burden of respiratory viruses circulating in Canada right now. So we've got influenza, we've got RSV, we've got COVID, and again, there's other respiratory viruses out there that we just don't discuss, but certainly the list is longer than my arm, and they're all circulating. Many of the syndromes overlap, so sometimes it's hard to distinguish what's flu, what's COVID, versus what's RSV. Based on a purely clinical picture, we end up getting tests to distinguish them from each other, and some of them have targeted treatments, others it's more supportive care and supportive management in hospital.
One of the major drug makers is saying it's developing a vaccine for pregnant people and older adults. When could we see it potentially available?
Well, hopefully in the next year or so. These are in advanced clinical trials, and the results that have come out look extraordinarily promising, especially this one for pregnant women. We've seen that what happens is they produce antibodies to this vaccine, and of course the antibodies are then transferred to the unborn child, and then the child, who now presumably has some protection against RSV and protection against severe infection. This would be most welcome, in addition to a vaccine for older adults who are vulnerable to this infection. I'm hoping in the next year or so, but I think we're seeing so much progress in this field from multiple organizations, multiple companies with very advanced clinical trials rolling out. We'll probably see something sooner rather than later.
So more kids are getting it, and it seems to be hitting them harder because we've had this prolonged period of no exposure to anything. And now there's this widespread Tylenol and antibiotic shortage. So what advice do you give to parents who are worried about how do I treat symptoms? We've also heard concern from some doctors that parents are maybe waiting too long before they're bringing their younger kids in.
Yeah, so for starters, if you're worried about your child and if there's any issues with breathing or with feeding or with hydration, it's time to come in. And again, even though it's busy in healthcare, our doors are never closed. We are always here to help, and we will do everything we can to help you and your family. So do not delay coming in if your child is sick. And that really means difficulty breathing, difficulty feeding, if they're somnolent, or this is clearly time to come in. And of course, there are things you can do to protect yourself and protect those around you. For starters, there's vaccinations for circulating viruses like influenza and COVID, which go a long way in reducing severe illness. And of course, we know masks. Masks are extremely important. Wearing masks in indoor settings can help reduce the risk of getting infected and can reduce the risk of onward transmission. And just like we heard Dr. Theresa Tam strongly encourage Canadians to wear masks, I think you're going to hear this from just about every public health specialist and every physician across the country. It's time. I mean, our healthcare system is stretched. There's lots of respiratory viruses circulating, and you can reduce your risk of getting infected by putting on a mask in an indoor setting. It really is that simple.
Dr. Bogosh, always good to have you. Have a great weekend.
My pleasure. You too.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.